Hi, I'm Emily Branch, Conversation Health's head of community, and I'm here with Edward Galad, head of the Value Office and Pre-Sales, to discuss the economic impact of virtual rep. Hi, Ed. Thanks for joining me.
Hey, Emily. Thanks for having me.
My first question is the Conversation Health value process different from traditional ROIs?
Great question. Day and night. Traditional ROIs used by vendors all over, whether they're selling SaaS or AI or any product, 80% of it's on cost. 20% is on revenue. What we do at Conversation Health is we reverse it. We emphasize the revenue part, the RX lift. And then additionally on top of it, it's just not an engagement where a company will meet with a salesperson and they'll go over some numbers and they'll produce an output. We're actually engineering this based on a different set of data criteria from the pharma industry and doing it with the client. So it's a true version with revenue, if you ask me.
Why did you decide to build a rapid value assessment platform?
Well, we looked at the space, and in conversational AI, there aren't really many, hardly any actually, vendors that are leading with supporting HCPs, patient measurement, and optimizing what they're selling for business outcome. The big pharma, the biotech, they want outcomes. They don't want to buy technology. And so what we did is we decided to put together this platform, and it preempts having the pharma company understand what we're giving them because we serve it up front. The other vendors, it's more of a build versus and they will come mentality. We don't buy into that. This is a compliance. This is a high quality data. This is a trust relationship. And we just believe that you have to have a platform, and we decided to engineer this.
What role does the rapid value assessment platform play in helping the pharma industry produce growth?
Pharma industry is in a very tough spot, in my opinion. They have three choices right now. They can hire more reps, which is what's been going on for forever in the industry. It's very effective to sell more script to the doctors. Or they can double up on the reps and give them more HCPs to call on, or they could virtualize. Well, in the industry is pretty known that they're not hiring. In fact, they're diminishing sales teams, quite a bit, almost across the board. That's not viable. You can only see 80, 90, 100, 110 doctors or HCPs if you're a rep. You can't give them another 50. It's a logistics problem. So you have to virtualize. So the rapid value assessment program or platform is our way of communicating to the industry. We understand it. So why don't we go on the third, which is virtualization? And how do you do it? What will it cost? What will you get? And engage in a business outcome conversation and let the product speak for itself, sort of secondary. And that's when you deal with senior executives up to the C-suite, that's the way they want to engage. And that's how we put the platform together.
How does Conversation Health use the rapid value assessment platform?
We use it in almost a full disclosure mode. We look at a company, pharmaceutical company. We take a look at their HCP universe. We take a look at how many reps they have. We take a look at the molecules, the drugs that they're selling, and we look at the gap. We look at how they're doing with getting script lift and revenue production with their drug, but how are they lagging behind a large or a sizable competitor? We analyze that gap. We then take the platform that we have and we create a value hypothesis. Imagine, I guess, the old school knocking on a door and getting to a very senior person in a pharma house and saying, we want to present a value hypothesis, how we can close the gap because you have 200 reps, your large competitor has 800, they have X percent of a revenue, you have X plus X minus Y, and here's how we can close the gap using a unique conversation AI, which is virtualized. It's a unique approach, and we're getting a really, really good reception on that.
Regarding the competition, do they have an equivalent rapid value assessment platform?
Not that we've seen anything at all similar like that in the industry. What we have seen are vendors very capable, and they lead with TCO. That stands for total cost of ownership. Total cost of ownership is how you explain to a corporation that in 2 or 3 years, this is what their cost will be to own and use the product, licensing, implementation, etc. What we have seen, which is very interesting, they lead with this, but their pricing against us or their costs are significantly higher. So we don't see it, but we like what we see, if that makes any sense.
What are Conversation Health's value assessment, and how do they help produce more script lift?
Value assessment is a process that is widespread among the upper echelon within the enterprise, pharma, fortune environment. It's when a well-established company comes in and says, we're not trying to do business and sell you. Let's do an assessment and see if there's a fit. Let's see if our technology and our process will bring value to you financially or operationally or technology based on your technology stack with your staff and your team and how that will align. And more importantly, does it fit strategically with what you're doing for the next year or two? And when the potential client agrees to an assessment, it's a fabulous way. They pay a few dollars, not much, but they get the data and the insight. Then they can not just make a well-determined decision, they can go to the C-level and they actually have a roadmap to then institute it. It's a tremendous way of doing business. And in pharma, because of the size of the companies, it's well regarded.
What are the components of the rapid value assessment platform?
There are 4 components, Emily. It starts with the value driver. What are we trying to measure and what is driving that? Number of reps, number of HCPs, number of drugs or molecules. So think of that as the input. And then there's the value determination. What's the mathematics? If you want to determine something like script lift, what is being determined or multiplied or calculated to do that? So that would be the second one. The third one is the value multiplier. This is sort of unusual and really exciting. It's in a way to adjust what's being modeled. So perhaps you want to deliver more script lift, or perhaps you want to adjust our selling price based on a volume deal. So we're able to actually model in real time. It's the value multiplier, call it the value adjuster, but it's the same thing. And then the final one is the value hypothesis, the output. Show me the money, show me what we have, what are we paying, and what do we get? And the 4 of them integrate, and that's how it works in real time really quickly.
How does Conversation Health present value to our different brand groups, including commercial, IT, MI?
Think of everything as being in its own compartment. And it's hyper-personalized. So for finance, we talked about leading with revenue as 80%, cost. We present our value hypothesis, and we present it to them aligning to their priorities and how they're spending and what they're looking to achieve financially. When it comes to the commercial end, they're very focused on production, lift production, rep production on script lift. So we model more on that, and we talk about the value drivers and the value determination for that. When technology folks come in and they want to know how it works and how do they support it and where it fits, we then model the impact of, using our platform and not having to spend extra money where it's supported. And therefore, they understand the fit, not just from an operation, but also a technology basis. So each one is individual, but they all roll up together to be very similar.
Can the Conversation Health value process be customized for specific brands?
Yeah, that's almost like a loaded question, because if it's not customized, then you're taking a generic platform and you're saying this is one size fits all. And it doesn't. We have potential customers that we want to work with that have a drug on, oncology and cancer, which is a horrible situation to even talk about, but it's very complex. They might have 4, they might have 5 drugs and there's overlap in treatment. So it has to be very personalized to what they're marketing, the HCPs. And then, of course, you market that to an oncologist or hematologist. What about a general practitioner? They don't do that. But in parts of the country, we don't have an oncologist. The PCP takes over. So yes, they're highly personalized.
How would a brand know if the numbers are accurate and not vendor biased?
Well, it starts with transparency. And transparency builds trust. And that's how we can address this. So number one, we begin with their numbers. It's the pharmaceutical company's numbers of how many reps do you have. It's part of the value driver, value calculations. How many HCPs did they see? What type of breakout between C and no C? We have our breakouts. How do they have that? And then we bring our own data in, such as where is the HCP universe going and how much is the gap between the size of doctors that their largest competitor is seeing and how many doctors the target company we're trying to work with is seeing, and how do we close that gap? And again, transparency is everything. And when we do segments, we have 300 million patient journeys. We have NPIs. We have a 10-year look back. We've done it for 42 of the top 50 pharma companies. So when we present this in the value assessment platform, it's all fully disclosed. And the bottom line is it's disclosed from the first day. We lead with the value, we lead with the data, and we lead with the trust. And then that then builds the engagement, where most vendors do it the other way. They sell it, they present it, they demo it, and then they bring the ROI in with the pricing. We reverse that. So the believability in the numbers has not been, a problem at this point. It's just more of, building the relationships.
Can the rapid value assessment platform help companies sell to finance and executive leadership teams? And if yes, how so?
So if you remember a few moments ago, we were talking about the assessment. Imagine working in a very large drug company. You have to virtualize because you need more production of revenue and script lift and share. And you have to go in front of the CFO and you have to say, we need X amount of dollars. You need a business case. And not just a business case that the vendor did, you need it that was done collaboratively with you and the vendor. But additionally and above and beyond that, they want to know internally, has this been vetted? Has the buying committee seen this? Are they behind it? Who was involved with it? So when we do an assessment, and that could run several weeks or a tad longer, it's fully collaborative. So imagine the CFO getting an assessment output with a proposal and a buying committee saying, we vetted what we want and this is our choice. It makes it very, I wouldn't say very easy, it makes it easier for them to make the decision.
Does the rapid value assessment platform measure the impact of increased reach, frequency, and engagement on high-value C and no-C HCPs and the expansion beyond NPIs?
It does. And your key word was impact. And that's what we started with when we first started talking, that we're measuring the impact and business outcome. So to give you a specific answer, absolutely. The value drivers will include how many reps, how many HCPs are being in the territory. Then we look at the universe. How large is it? What percent can we drive to the universe? And the reach and the frequency and the engagement are all part of that. And we're having an hypothesis based on where we see this being done by using our segment and, of course, using our virtual rep. And that then leads to the last one, which is the engagement. And will the no-C see a rep? We can't say that. But will a no-C see a virtual rep? Yes, absolutely. So then there's measurement on that, and there's measurement on the C doctors and their use of the virtualization. So long answer to a short question, everything is measured and everything is part of the business outcome.
Well, thank you, Ed. Thank you for sharing this information with us.
Thanks for having me.